Hi, I'm Dr. Chikly. I would like to talk to you about the foundation of LDT, the very first stroke. That is a stroke that is something that has been described and researched by science. And this rhythm, you can apply it with your hands. Before going to more difficult and sophisticated techniques, we just have to go into that flow. And you apply your hands on the layer, the specific layer you want to work on. I'm going to stay superficial. I apply my hand very flat. You have to be like an algae. You have to be something like flat cushion and pads of your hands connecting with something very soft. And you bounce and you feel what is the lightest touch you can have and still bouncing on a fluid layer. And when I'm there, I'm going to wait for a wave and I'm going to go with it. 1, 2, almost 3 seconds here. And you come back. It's something you barely see. I'm going to exaggerate a little bit. You barely see that movement, but this is happening in the body all the time. Here we go, it's going up a little bit. You have a light supination of the hands and it's coming down a little bit. And you're going to check by doing that the depths you are in, the quality of the lymph flow. Is that something very fluid, like the white of an egg, for example, or sticky, like mucus if you have allergy, fibromyalgia, some kind of infection, for example, the lymph become more sticky if you have inflamed, chronic inflammation. And this is something that is very gentle, very non-invasive, and it really looks like nothing, but you can do a lot with a light stroke there. And then you can do a little change in your perception and see if you are going superficial, the lymph is going actually up toward with the axilla with a slight diagonal angle. But if I go a little deeper, especially if I'm on a rib with those fingers between the ribs, the lymph is going more medial towards the sternum, the intercostal fluid circulation. And if I stay flat, right there I'm on the liver, it's going to go superior toward this right clavicle. Or we can go more, if you go a little deeper in the liver, you can go more medial toward the cisterna chyli. And then if I barely move, I go right there on the ascending colon. This fluid is going more medial toward the superior mesenteric nodes, right there. So you can play with different layer of lymph, the quality, different rhythms, because you have a rhythm for the lymph capillaries and the lymph collectors. And something very basic but very gentle, something that animals love to receive. Animals usually relax, baby relax. If they begin to cry, just give them a little of that hypnotic, rhythmic, gentle stroke. And it's something that can do a lot. Then we can apply it a little bit and combine it with the fascia. For example, in the small intestine, I'm going to have a little torque there, so I'm going to relax a little bit this intestine and send the lymph. And that's much more efficient. Now, the intestine itself, what we call the ostration of the intestine, it's much more regular. There's no torque anymore. It took that gentle stroke to combine together lymph and fascia restriction. And I go back with my lymph stroke. It's just beautiful now. Remember, every time you move that lymph, you're going to drain toxins and peptides and hormones and lymphocytes and macrophage and proteins and some fat, very rarely red corpuscles, but it's something that's absolutely amazing to feel, and it's also connected with consciousness and emotions. So by receiving that, she really relax, really reharmonize all the body, all the tissue in our bodies. You have to understand the water molecule is free to go through all the barrier, the blood-brain barrier or the cellular membrane. This water molecule that has been reconnected with the lymph rhythm is going to go everywhere in the body and reharmonize, reunify the whole field there. There's something very interesting to work with. And then in more advanced layer, we're going to go, more advanced classes, we're going to go in more sophisticated techniques, but you need to have this foundation of lymph. That is something very special, and I think we're the only school in the world to show the very specific rhythm, direction, depth, and quality of the lymph flow, something consistent with the scientific research and discovery on the lymph system. Thank you. Thank you.